At a Senate Help Committee hearing on September 17th, Ousted CDC Director Dr. Monarez faced tough questions from both sides of the aisle. Testifying before Congress, she addressed her departure, vaccine policy, and recent comments made by Robert F. Kennedy Jr. Here are the top moments from today's hearing.
Why did you believe it was so important for you to refuse to rubber stamp vaccine recommendations without seeing them or the evidence behind them? What did you fear was the worst-case scenario if you had agreed to doing that?
I refuse to do it because I have built a career on scientific integrity. And my worst fear was that I would then be in a position of approving something that would reduce access of life-saving vaccines to children and others who need them.
So you resisted firing people who have this idea that the COVID vaccine should be at 6 months. That's what this is about. You didn't resist firing the perfect, beautiful scientists that are career people and unobjective and unbiased. You wouldn't fire the people who are saying that we have to vaccinate our kids at 6 months of age. That's who you refused to fire.
So that assertion is not commensurate with the experience that I had with the individuals who are identified to be fired.
Did any of the people you refused to fire, did any of the people you
Allowed to answer the question?
Did any of the people you refused to fire believe that we should change the vaccine schedule and no longer force 6-month-old kids to take it? Every one of them was adamant we should keep it at 6 months. Everybody's alarmed, we're gonna change the childhood routine. Well, we should. There is no medical reason. What is the medical reason to give a hepatitis B vaccine to a newborn whose mom has no hepatitis?
So none of the discussion points that you just brought up were ever...
That's changing the childhood schedule.
Will you allow her to answer the question?
Regular order,
You have
regular
your
order.
time. You have your time,
order.
Bernie. I got mine. Look, this is the debate over changing the childhood schedule. The hepatitis B vaccine on the schedule is given to newborns. What is the medical, scientific reason and proof for giving a newborn a hepatitis B vaccine if the mom is Hep B negative?
I want to go back to the assertion associated...
What is the medical reason for giving a hepatitis B vaccine to a newborn? See, everybody's like blithely going along, we can't change the childhood. You're somehow terrible if you want to change the childhood. We should be discussing what is the childhood vaccine schedule, and the burden should be on you. You want to make all the kids take this? The burden is upon you and the people you wouldn't fire to prove to us that we need to give our 6-month-old a COVID vaccine and that we need to give our 1-day-old a hepatitis B vaccine. That's what the debate ought to be about, not whether all vaccines are good or whether we live in Alice in Wonderland.
I actually agree with you, and I was open to the science. I just would not pre-commit to approving all the ACIP recommendations without the science.
Untrue.
Is it fair to say that one of the ways you could describe your duties of the office is to protect the health of families and children by making sure you adhere to science?
That's exactly right.
Thank you. Doctor, as you've shared today, Secretary Kennedy demanded that you blindly rubber stamp his future vaccine decisions. When you pushed back on Secretary Kennedy's demands, how did he react?
He was very upset. The entire meeting was very tense. He was very upset throughout the entirety of our discussion, and it was not a productive exchange of information.
What was the Secretary's reaction when you raised the need to consult scientific evidence before making decisions?
I'm sorry, what was that?
What was the Secretary's reaction when you raised the need to consult scientific evidence before making decisions?
Yeah, it was, this is when he stated that CDC had not collected the data or the science. There was no scientific evidence associated with these vaccines. He said that CDC had failed in its duties to be able to appropriately evaluate the safety, the efficacy, never had conducted controlled clinical trials, placebo-controlled clinical trials associated with the vaccines. He made another set of assertions associated with CDC that were particularly pointed. and particularly hurtful and disparaging. He called, in that context, CDC the most corrupt federal agency in the world, emphasized that CD employees were horrible people. He had said that, I'm sorry. He said that CDC employees were killing children and they don't care. He said that CDC employees were bought by the pharmaceutical industry. He said CDC forced people to wear masks and social distance like a dictatorship. And the one I think that hurt me the most was a particularly vivid phrase he said during the COVID outbreak. CDC told hospitals to turn away sick COVID patients until they had blue lips before allowing them to get treatment.
And it is fair to say, in your view, that those statements are not true.
Those statements are not true.
Thank you. What was the Secretary's temperament as you pushed back?
He was very upset with me. The temperament was similar to the times under duress during the Senate Finance Committee hearing, if that is helpful. He was extremely animated towards me in that room.
Was the Secretary's thinking and reasoning clear to you during those meetings?
The Secretary was clear in the two things that he was demanding of me, demanding to fire those scientists and demanding of the pre-approval of the vaccine recommendations. Some of the things that he was talking about were clearly not aligned with the scientific evidence that I knew related to safety and efficacy and placebo-controlled trials. And the conversation seemed to change points very quickly. Okay. It was hard sometimes to follow the logic that he was putting forward. And again, he was very, very upset and very animated.
Let me ask you something. Your conversation with the Secretary, you said that he said he didn't trust you.
Correct.
You testified to that. Is that really how that conversation went? Because there's other people in the room, and I think the conversation was, can he trust you? And your answer was?
He said he could not trust me.
No. The answer, ma'am, it was a recorded meeting. So you can testify one way, or you can prove that you're lying or be honest with this committee. I'm giving you the opportunity to be honest here because you've been really walking around the edges and not being truthful. So did he ask you the question, can he trust you? And your answer was?
He told me he could not trust me. And I told him if he could not trust me, he could fire me.
That isn't how that conversation went. And you know that, don't you?
He told me he could not trust me, and I told him if he could not trust me, he could fire me.
Ma'am, all we're looking for is you to be honest.
Op-ed opens with a harrowing account of the August 8th shooting, and clearly both you, the entire leadership, and the entire building is still reeling from that moment. 180 rounds being fired into the CDC. What a traumatizing event. I want to ask you about your fears, and Dr. Horry, be glad to hear your thoughts as well, for the safety of our personnel at the CDC and the medical profession writ large. If more and more people believe that those that are recommending vaccines for our children and our families are hurting people. Clearly, you have to be unhinged to take a gun and fire it into a medical building. But these conspiracy theories about vaccines and about the people who are recommending vaccines, I fear they come with consequences. Do you fear for the safety of the CDC and of medical personnel if these beliefs about the CDC actually recommending things that hurt people continue to become mainstream?
I do worry about that. I myself was subject to threats, and I am very concerned that the further promulgation of misleading information will undermine not just the safety and health of our children, but it will also exacerbate some of these tensions, the willingness to commit harm if someone is affronted by a belief that the people like us that are trying to help them are actually not trying to help them.
For more congressional news, stay tuned to Congress Clips, and thanks for watching.